Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. National Commission for Protection of Child Rights asks all states and union territories to upload data of children who lost their parents to COVID-19. Union government says COVID vaccine trials in children in the country to begin soon. Ministry of Education launches YUVA Prime Minister scheme for mentoring young authors. And State Education Department releases video and booklet on improving immunity in children during COVID-19. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. National Commission for Protection of Child Rights, NCPCR, has asked all states and union territories to upload data of children who have lost either one or both parents to COVID-19 on its Bal Swaraj portal. Bal Swaraj is an online tracking portal of the NCPCR for children in need of care and protection. NCPCR, in a letter written to all the states and union territories, has informed that in view of the current situation of COVID-19, it has extended the use of the portal for tracking children, including details of children who have lost either one or both their parents due to COVID. It said a link under the name of COVID Care on the Bal Swaraj portal for filing of data of such children by the officer or department concerned has been added to facilitate the collection of information. The liberalized and accelerated Phase 3 strategy of COVID-19 vaccination drive has already been started in the country. Union government has said that no country in the world is administering COVID vaccine doses to children under the age of 12 years. The centre has said trials in children in India are also going to begin soon. Recently, Bharat Biotech's COVID vaccine, Covaxin, has been granted permission to conduct Phase 2 and 3 trials for the age group of 2 to 18 years. Expert panel of the Central Drug Standard Control Organization had recommended the conduct of trials. Government has stressed that the decision to vaccinate children is to be made by the scientists based on the results of the trials. Ministry of Education today launched Young, Upcoming and Versatile Authors, YUVA, Prime Minister scheme for mentoring young authors. It is an author mentorship program to train young and budding authors below 30 years. The launch of YUVA is in tune with Prime Minister Narendra Modi's vision to encourage young writers to write about India's freedom struggle. It was during Man Ki Baat program in January this year that Prime Minister Modi called upon the young generation to write about freedom fighters and incidents associated with freedom struggle. YUVA is a part of India at 75 project to bring to the fore the perspectives of young generation of writers on themes like unsung heroes, freedom fighters, unknown and forgotten places. School Education Department Nagaland has released a video and booklet on improving immunity in children during COVID-19. The booklet contains pictorial representation of various food items along with brief description to boost children's immunity. It also contains immune-boosting exercises for children. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. National COVID-19 recovery rate has further improved to 90.80%. In the last 24 hours, 284,601 patients have recovered. Active caseload in the country further declined to 22,28,724. In the last 24 hours, 3,617 deaths were reported. With this, the death toll due to the pandemic has reached 3,22,512. In the last 24 hours, over 30,62,000 vaccine doses were administered. Union Minister of State for Chemicals and Fertilizers, Mansukh Mandaviya, has informed that the country has now a surplus quantity of antiviral drug remdesivir due to the centre's active intervention to ramp up its production. Mandavia said that production of the vital drug used in medical care of serious COVID patients has been ramped up nearly 10 times in a short span of just 1 month. He said starting from the production capacity of around 33,000 vials per day in mid-April, the nation today produces around 350,000 vials of remdesivir in a single day. The minister also informed that the number of production plants of the antiviral drug has been increased from 20 to nearly 60 plants within a month. Civil Aviation Ministry has said that airlines can operate with 50% of flight operations from 1st of next month. The step has been taken in view of the sudden surge in the number of active COVID-19 cases, decrease in passenger traffic, and passenger load factor. Civil Aviation Ministry had increased the limit to 80% in December last year as a measure to open domestic flight operation in a calibrated manner. After the initial restrictions on domestic flight operations due to outbreak of COVID-19 pandemic in the country, the central government had permitted the domestic flights operation in May last year. Meanwhile, the ministry has decided to raise minimum fares of domestic flights from 13 to 16%. This will come into effect from 1st of June this year. Centre has invited Hindus, Sikhs, Jains, Buddhists, Parsis and Christians belonging to Afghanistan, Bangladesh and Pakistan and residing in 13 districts of Gujarat, Rajasthan, Chhattisgarh, Haryana and Punjab to apply for Indian citizenship. Union Home Ministry issued a notification in this regard yesterday for immediate implementation of the order under the Citizenship Act 1955. People who are eligible to apply for Indian citizenship are those currently living in the districts of Morbi, Rajkot, Patan and Vadodara of Gujarat, Durg and Baloda Bazar in Chhattisgarh, Jalori, Udaipur, Bali, Barmer and Sirohi in Rajasthan, Faridabad in Haryana and Jalandhar in Punjab. Deputy Commissioner Beren Senti Wapangaya has notified that in view of detection of COVID-19 positive patient and in order to take preventive measures to contain the spread of COVID-19, District Hospital Beren has been sealed with immediate effect from 28 May until further notice. The DC also advised the public to follow all safety precautions, especially within the proximity of the sealed area. The DC further cautioned that any person violating the order will be liable to be prosecuted as per provisions of the law. Deputy Commissioner Mon Tavasilanke has informed the District Task Force for COVID-19 vaccination will be organizing a drive-through vaccination camp for beneficiaries who are 45 years and above, frontline workers and healthcare workers on 31st May at the local ground Mon Town from 10 a.m. till 3 p.m. The DC has issued COVID-19 related information. In case one is not able to go for vaccination on the date of appointment, they can reschedule the appointment by clicking on Reschedule tab in the portal or app. One can cancel an appointment already scheduled and also reschedule the appointment and choose another date or time slot of their convenience. Once an appointment is scheduled, they will receive the details of vaccination center, date and time slot chosen for appointment in an SMS sent to their registered mobile number. The appointment slip can also be downloaded and printed or kept it on smartphone. And now 20 News, here are the main points again. National Commission for Protection of Child Rights asks all states and union territories to upload data of children who lost their parents to COVID-19. Union government says COVID vaccine trials in children in the country to begin soon. Ministry of Education launches YUVA, Prime Minister scheme for mentoring young authors. And State Education Department releases a video and booklet on improving immunity in children during COVID-19. That is all we have in this evening news bulletin. Good night.